Good morning, Dr. Rex Archer. How are you doing this morning?
Doing well. It's a little busy right now. Sometimes when people ask me how I'm doing, I'm saying I'm bored, but obviously everybody knows that's not true.
Yeah, because I know you were doing a lot of work with the health department. Also, thank you for the awesome work you do. Thank you for finding time in your schedule to come on the show today. This is awesome, and I definitely know that my audience are gonna be able to learn from a lot from this, conversation today. So let me introduce you. For those of who do not know, Dr. Rex Archer serves as the Director of Health for the City of Kansas City, Missouri. In addition, he also serves on the Public Health Accreditation Board of Directors and chairing PHABS. And also, he has been he's been the director of health for a long time now, being the leader. And I just want to say thank you for that. Also, being a leader in that of health for us for a long time. And I want to ask you this: kind of let people know a little bit more about yourself so they can know who you are today, how you got to where you are today.
So in 1957, I was 3 years old and I was hospitalized with the 1957 flu pandemic with
Okay.
influenza. And had asthma and different challenges up through fifth grade, got involved with tackle football, and all of a sudden I didn't get pneumonia anymore. And so as I was preparing for and was lucky enough to, we were state champs all 3 years I was in high school over at Shawnee Mission North. They haven't been very successful more recently, but
Yeah.
um, I got a real opportunity to be in various leadership roles. Went to med school with KU and decided that I really wanted to be part of preventing problems and not just trying to treat problems. And so I did my master's in public health and preventive medicine residency at the University of Michigan. Uh, but I was lucky enough to go to a CME program, continuing medical education program in Chicago, and got the public health bug again from that. And so went back into an Appalachian County in Western Maryland to be the health director there. And then moved back here in Kansas City a little over 21 years ago. So
Wow.
it's been fun, lots of different opportunities, and yeah, I was here during the anthrax attacks of 2001, and in fact, I just got a really nice note from former Mayor Kay Barnes thanking me for what we're doing right now under COVID-19, but also reminiscing about how we worked together back during the anthrax attacks in 2001.
Awesome. I want to ask you this because there's a lot of news, not even news. A lot of restaurants opening up. The city is kind of opening up right now. Now, with that happening, what are some things that we should look out for, and what are some maybe guidelines or some policies that the health department is putting out there to make sure people don't get infected rapidly?
Well, we're fortunate to have a very strong mayor, Mayor Lucas, and his executive orders that have been going out, I think, have been exactly where we need to be
Mm.
at each stage. There has been a lot of pressure because of, to be honest, some insanity at the White House, and the White House has been muzzling the CDC, not coming forth with recommendations from the CDC, et cetera, and ignoring that,
Mm.
which has created a lot of chaos when somebody recommends crazy treatments like injecting yourself with bleach or uh,
Yeah.
putting UV lights in your body. I mean,
Mm.
it's
Mm.
just bizarre, and
Yeah.
that's been very challenging. And then when you get both sides where this says, well, we got to open up the economy, but it's not safe yet. Oh, we have plenty of tests. Oh, no, we don't. We have enough folks in public health to actually manage these outbreaks. So obviously we don't.
Mm.
So these mixed messages have been a disaster. Both governors have felt political pressure to open up the economy, and we're not ready yet. Now, will we be pretty soon? Maybe I'm hoping, but The problem is that we're getting outbreaks in meatpacking plants. We're getting outbreaks in nursing homes.
Mhm.
We've had outbreaks with choirs of congregations. So yeah, this is a real challenge, and something that actually in my presentation will kind of hit on a little bit more.
Yes, yes. Now, awesome, awesome. Well, I just want to ask you a few questions just to introduce you to the audience, and also, get some insights about what the health department is doing to make sure that people are not don't get that peak in COVID-19 infections. So, I will give you a chance to go into your presentation and get us informed.
Okay, let's see here if I can share my screen. Okay, good. So, unleashing the power of public health leadership, and for whoever's listening, leaders are very critical, and it's not something that you just all of a sudden fall into, but you need to continue to work on and develop. And you'll notice different types of leaders here, from our next generation to Wonder Woman and her truth lasso to various other endeavors that I think are important as we look at role models out there.
Yeah.
We are. So if you do Twitter, that's my handle, and I guarantee I will put some controversial stuff out there, so it may be interesting for you to pay attention to some of those issues. I try to follow the folks that I think are not being muzzled right now, and are telling truth to power. So Dr. Jarvik, the inventor of the artificial heart, says leaders are visionaries with a poorly developed sense of fear and no concept of the odds against them. They make the impossible happen. There's an interesting book by Carol Dweck on a mindset. And if you think about it, I was raised up basically in white privilege. And every time I made a mistake, it was kind of like, okay, how quick can you get back up, and what do you learn from it?
Mm.
And that's very different than being punished for things that you didn't even do. As we know, being arrested for driving while being black, or the fact that even today whites can wear masks in public, but sometimes when blacks do, they get inappropriate reactions from others. And so, we've got these constant issues of are we allowed to take risks, or are we afraid to? And the problem becomes that if you don't work through to a growth mindset, you end up limiting yourself. I've had employees at our work where they're not making mistakes, but the problem is they're not taking enough risk to grow. And
Yeah.
so I'll actually have to come up to them and say, oh, guess what? You're in trouble. And they kind of go, what? And I go, yeah, you haven't made any mistakes this last month. You're playing it too safe, and you're not growing.
Wow.
and kind of put them into a different mindset.
Yeah.
When you think about a crisis, I really put this on everybody's reading list. Dr. Joshua Sharfstein was the Baltimore City Health Commissioner, the state health director in Maryland, and a deputy for the FDA. And this survival guide book is just a great read for anybody that wants to understand leadership in crisis and how to maneuver within that. And he basically lays out in the book, you have to recognize that you're in a crisis early on and manage it and communicate. But then you have to be pivoting to managing the crisis and advocating to long-term policy change that can prevent the next crisis.
Mm.
That's part of why we've been talking a lot about paid sick leave and quarantine leave in this nation. There are 159 other countries, when I published an article a couple of years ago in health security, that have mandatory paid sick leave. And we're one of only 2 or 3 in the top 50 economies that doesn't do this. And it's part of why this outbreak is out of control in this country, is that we don't have paid sick leave. Jokingly, I've often said we should require all businesses to post a sign, um, whether they have paid sick leave for their employees or not. And if they don't, then they should say, shop here at your own risk because our employees can't take off if they're sick.
Wow.
And then last, how do we awaken a sense of crisis on longstanding problems to change where we don't really have a crisis there, but can we use a mechanism to change things that are longstanding? The inequities in this country, we don't just have a viral crisis right now with COVID-19. We have a moral and an economic injustice crisis that we need to be facing as a nation. President Eisenhower and Stephen Covey have this pretty famous time matrix. You may be familiar with the concept of you have this urgent column and non-urgent, and then you have important and not important. And if you think about it, the challenge is to not just work in the important and urgent, but to avoid working too much in the not important and urgent, find ways to not do that. Certainly, most of us know you want to limit the amount of time that you're in not important and not urgent things. But the real challenge often is focusing in the upper quadrant of what is really important but isn't urgent. It's not pressing you to do it now, but if you don't do it, it can cause problems. And a piece that I add to this slide is relationship building, because relationship building is often never urgent, but it's extremely important and it can help you a lot. If you think about this, we need to be moving from equal 25% time in each of these boxes to substantially increasing the amount of time that we spend in the important and not urgent box. That then actually reduces the inefficiency of us working in some of the other areas. About it, and this is part of leadership, is creating an understanding and a new mental model. In this country, in some ways, some people believe, well, the way you stay healthy is you have to make enough money or work for an employer that provides health care insurance, and that you basically buy your health from a healthcare provider. And that's the model here of unhealthy behaviors and risk factors lead to disease and injury and lead to death. But there's a quality improvement methods of asking the 5 whys. Why do people die? Because of disease and injury. Why is that? Because of unhealthy behaviors. But if you've been around 5-year-olds, they keep asking why, and eventually you get the root causes. So if we ask why, we move further upstream. And now we've got our biased beliefs, our isms, whether that's racism or class or gender, any tribal way that we are separated, us from them, and therefore it's okay to not care about them because they're not us. That creates harmful policies and practices like the redlining and blockbusting, the J.C. Nichols, the plaza, but he also created policies that exported to the rest of the country that created a lot of our racial divide and harmships in most of our communities, and then put those communities basically on life support. So yes, we can have hospitals and we can have clinics and we can have health education, and we can spend over $3 trillion now. I haven't updated this slide. I think it's $3.6 trillion we spend on illness care each year, twice as much per person as any other country in the world. And yet we're 40th, 45th, and dropping in life expectancy. Can you imagine if we, in the Olympics, instead of scoring in the top medal count, we were 45th or 50th, what an outcry there would be. And yet most people in this country don't even realize that there are 40 some other countries that live longer than we do, and everybody seems to be okay with that. So as we move upstream, we have to have power and leadership in our communities. All of the folks that are listening to this have opportunities to grow and move into leadership in communities. We have to focus on new policies and partnerships. And ultimately, we have to change the narrative of how we even talk about ourselves. So we move into inclusion, sustainability, health in all policies, and having more resilient, transformed communities. And these become the real drivers of change. So if folks are interested, working upstream on the left side is where we'll actually change our culture and make everybody happier and healthier and more productive. Data is important in leadership and public health, anecdotal stories, but also real data. And when we look at what's causing death in our city and in our nation, not graduating from high school, our racial segregation, individual poverty, community level poverty, and income inequality. In fact, income inequality is the best predictor of the difference in life expectancy between different countries as well as states in this country. And what you'll see here is the total deaths each year from the US. We've then done analysis at the zip code or district level within our city, and you can see somewhere between 1 out of 3 and 1 out of 2 of our deaths every year are due to these 6 factors. I skipped over low social support, but this one is particularly important because, and it's made up of 4 different factors, but it basically looks at, do you have a group that you're part of that will support you when you're having challenges and problems, and that you will be supporting them when they need you? And that is a major predictor of how long we live and how happy we are. Robert Wood Johnson Foundation, I mentioned that we had led our community to win this prize, and part of the reason we won that prize is their model basically shows that the most important thing for health is policies and programs. Then looking at health factors, which then make health outcomes of length of life and quality of life. And you can see the relative proportion that clinical care in their model is at most 20% of how long we live or how healthy we are, but the social and economic factors are twice as important. And to visualize this another way, you can throw all the money in the world, $3.6 trillion in the US, trying to solve this tree on the left. If you don't deal with the unhealthy roots in the trunk, you're never going to have good fruit. And I love this cartoon. The 2 scientists are working on guidelines, and one scientist says, you need to be a little more explicit there at step 2. Well, it turns out that under our 10 essential public health services, we look at monitoring health status, diagnosing health problems, educating everybody on those problems. We then are pretty darn good also at policy implementation and enforcement. Where we as a public health system in this country are weak is where the miracle occurs, which is community mobilization and policy development. And as an example, we knew that we had at least 24,000 of our residents in Kansas City, Missouri, living in substandard rental properties that were unhealthy and unsafe. Got the community mobilized, and they took it to the voters, and it passed with the 57% voter approval. So we've now dealt with over 1,800 complaints on rental properties and have been getting those addressed and fixed through that process. So for us, public health is a social justice enterprise where we take justice, and it takes both truth and power. We can bring the public health data research, but the community has to organize around it. And ultimately, if that community or congregations or the chamber or whoever, we can come together, create justice, and improve things through these social movements. Power is critical. How do we influence decision makers? How do we shift the narrative? And as Dr. King says, power is the ability to achieve a purpose. Whether or not it's good or bad depends upon the purpose. And there is a great document on the four faces of power. I don't have a lot of time to go into it in detail. I give the reference down there for folks at grassrootspolicy.org. And each of these four faces of power we deal with on a regular basis as a health department. So ultimately, public health is an investment, not an expense. FAB accreditation is an investment, and reaccreditation, we are one of a handful of departments that is actually now not only, and some lessons that we've learned is even when you're pretty good, you still have lots of room for improvement. Even when you see the connection big picture as a leader, many of your staff or others in the community may not yet, so you've got to keep working on communication. And one thing I keep reminding myself is my staff is accomplishing some great things that I'm not aware of. And, you know, sometimes the problems come up to me, but I don't always hear about the great stuff. So with that, I kind of get out of this presentation and then kind of go back to any dialogue you have here for the last few minutes of our time together.
Yeah. Now, what do you think? How do you think we can be able to, create maybe solutions to issues in the U.S. regarding to starting pandemics in the future that might come out to make sure that people who do not have access to this healthcare or certain things can get access?
Well, we have to raise awareness that there are no gated communities. This virus doesn't stop at a property line.
Yes.
That eventually you have to come out, or even if you're staying in your home and you can work from home, you're buying products that are being brought to you by whether it's the FedEx or UPS or whatever, and if that worker is ill, then you may be getting the virus off of those products. So, you know, we're in this together, but getting people to recognize that is difficult sometimes. You know, we've been threatening to cut back on funding to the World Health Organization when we're going to have, I predict in the next 20 years, there'll be 2 or 3 new viruses or viruses that we haven't seen in this country for a while, but have mutated a little bit and will be invading us. And if we don't fund our public health system, if we don't provide, you know, sick leave and quarantine leave for folks, we're going to be vulnerable again. If we, and this isn't either party. Over the last decade, both parties have underfunded the CDC, have underfunded state public health labs. We're in the mess we're in because we didn't learn from the 2003 SARS outbreak in Toronto. South Korea did. They had the testing capacity and the contact tracing disease investigation mechanism, and they had around 300 some deaths, while we're, you know, probably going to have at least 300,000 and some estimates even higher than that. You know, it's really unconscionable, and there really should almost be people that go to jail. Although I'm not real big on incarceration as the best cure for things. Actually, rather than putting them in jail, I'd like to make some of these people that have made these decisions have to work in the soup lines and go around and do community service and pick up trash and stuff. Make them pay back to the community for the damage they've caused because they underfunded the public health system.
Now, actually, speaking on that too, I feel like that's a huge issue that we have, because I feel like every day we keep seeing unraveling news about the COVID-19 virus, of what it does, of how many people is affected. What do you think maybe the government or people in charge should have done right at the start of it to stop it from becoming this this huge of an outbreak?
Well, the first thing you don't do is disband your pandemic group that the White House has had for a number of years, and then
Mhm.
The current administration disbanded that group several years ago. So they had nobody there to advise them.
Mm.
Second, you have to listen to their advice when you do have folks there or somebody's telling you something. It was pretty clear in December of this year that this was likely to go worldwide.
Mhm.
Um, that's when we should have said, okay, we need personal protective equipment, so we're going to go into the War Powers Act and start making sure we have enough for everybody. That's when we should have sent, $10 billion to the CDC to then fund um, itself, but also state public health labs to start gearing them up, and down to local health departments to make sure we had enough disease detectives. We didn't have enough disease detectives to stop our syphilis outbreak before this even started.
Mm. Mm.
And so, it was that lack of recognition and deluding the public as saying, well, you know, it's almost gone. We don't have to do anything. Um, that was the big mistake. I am going to have to go pretty soon. Is there any
Yes.
last question before I
Yes.
leave?
There's yeah. I want to ask you this. This is a personal question to you. Being that you're so busy, when this is all over, is there something you want to do? Whenever we are all out of this lockdown situation.
Uh, in 24 to 36 months, because it's going to take that long before either 80% of the population becomes infected, so it slows down these outbreaks,
Mm.
or we have an effective vaccine. So it's going to be a while. But we still have to work on those social inequities and injustices because controlling the outbreaks is dependent on that.
Yes.
And yeah, whenever we can make some progress on it, you know, like I said, we need mandatory sick leave and quarantine leave. Um, we know that there is a digital divide, and
Yeah.
so helping folks that don't have access um, and having ways of doing more training and opportunities so that people can work safely from home, whether it's this virus or the next one. Um, so that's part of
Yeah.
what we need to be working on. Uh, we've got to, how to say this, and I will say it. So we spend 100 times as much money on the Department of Defense as we
Mm.
do on the Department of Biodefense or the CDC, Centers of Disease Control.
Yeah.
And that's not proportionate to the risk. The
Mm.
risk of us losing lives here in this country and being attacked from Mother Nature or an infectious agent that's bioweaponized is much higher than we're going to be attacked by another military power.
Mm.
So
Mm.
we're out of whack on our priorities of where we invest dollars. Um, and unless we change that, um, we're not going to be healthy. We're not going to catch up with other countries that live longer than we do and are healthier. And we're going to suffer on our economy because we won't be as productive as these other countries because their population's healthier.
Yeah.
So yeah, we don't have, if we don't learn the lesson from this outbreak, we will not stay a national power for long.
Mm. Mm. Wow. Well, I just want to say thank you for that awesome insight. um, it sounds
Well,
scary, but
thank you, and everybody keep learning and studying and looking at these issues because we need all of you to be the next generation of leaders.
yes, thank you for coming on, and
Uh-huh.
I hope you have a wonderful day. Stay safe and stay healthy. Thank you for coming on the FiredUp Show.
Bye.